Hello, I'm Jean Riddell, and this is Immunohematology Review. My references are the Clinical Laboratory Science Review, A Bottom Line Approach, and Denise Harmoning's Modern Blood Banking and Transfusion Practices. Part 1 of the Immunohematology Review covers donor selection, autologous donation, donor processing, donor collections, apheresis donor collections, and transfusion practices. Donor selection. What is the minimum weight for an allogeneic whole blood donor? The answer is 110 pounds. Donor selection. What is the maximum temperature for an allogeneic whole blood donor? Answer is 99.5 degrees Fahrenheit. Donor selection. What is the minimum interval between allogeneic whole blood donations? Answer, 8 weeks. Donor selection. What is the minimum hemoglobin for an allogeneic whole blood donor? 12.5 grams per deciliter. What is the minimum hematocrit for an allogeneic whole blood donor? 38%. What is the maximum volume of whole blood that can be collected per kilogram of body weight, including samples? 10.5 milliliters. What medication, if taken within 48 hours of donation, would have an irreversible effect on the function of platelets? Aspirin. If a donor presents for an apheresis platelet donation and took aspirin for a headache yesterday, can they donate platelets today if they feel well? No, they must wait till tomorrow. How long is a person deferred from blood donation if they had an exposure to HIV, hepatitis B, or traveled to a malarial endemic location? 1 year. How long is a person deferred from blood donation if they are an immigrant from a malarial endemic area or have previously had malaria? 3 years. A person who lived in the UK for more than 3 months from January 1st, 1980 to December 31st, 1996 is deferred indefinitely due to risk of what disease? Variant CJD. A person who had viral hepatitis after the age of 11 is deferred from blood donation for what amount of time? Permanently. A unit of red blood cells with the preservative solution cpda1 would expire after how many days? 35 days. A unit of red blood cells with the preservative solution CPD or ACD would expire after how many days? 21 days. A rejuvenating solution restores 2 molecules that are depleted during blood storage. What 2 molecules are restored? 2,3-DPG and ATP. A person who has a confirmed positive test for hepatitis B surface antigen or a positive hepatitis B virus nucleic acid test result are deferred for what period of time? They're deferred permanently. A person who has had a diagnosis of hepatitis C virus, HTLV, HIV, or T. cruzi, which is Chagas disease, are deferred for what period? Permanently. A person who has had a diagnosis of babesiosis is deferred for what period? Permanently. A donor's mother was diagnosed with CJD. Can the donor donate a directed unit of blood for her father? No, she is deferred permanently. A patient who is going to have surgery in 48 hours wants to donate an autologous unit of blood for themselves. Can they donate? No, must be greater than 72 hours prior to surgery. I'm looking for a unit of type O positive autologous red blood cells. It isn't on the shelf with the type O allogeneic red blood cells. Why isn't it on that shelf? It must be segregated. A person with an infection on their arm wants to donate an autologous unit. Why would we defer them? What is the danger? Bacteremia, which can lead to death in the patient. A person with an 11.9 grams per deciliter hemoglobin donated blood for themselves. They came back to donate a second unit and their hemoglobin was 10.9 grams per deciliter. Can they donate another unit? No, the hemoglobin must be 11 greater than or equal to 11 grams per deciliter. A person donating an autologous unit but was not able to complete the donation. 400 milliliters of blood were collected. What can we do with it? We can use it if it's labeled as low volume. A low volume allogeneic unit of whole blood was collected. Can I make packed red blood cells, platelets, and fresh frozen plasma? No, only low volume red blood cells can be made. A unit of cryoprecipitate must contain what amount of fibrinogen and factor VIII? Greater than or equal to 150 milligrams of fibrinogen and greater than or equal to 80 international units of factor VIII per bag. I separated a unit of plasma from whole blood donation. I froze it at less than minus 18 degrees Celsius for 24 hours. I thawed it at 1 to 6 degrees Celsius, centrifuged it, and removed most of the plasma, then refroze it. What product did I create? Cryoprecipitate. What is a process that can selectively remove needed components and return components that are not needed to the donor? Apheresis. A donor is donating blood that is specifically for their mother's surgery and not for any other patient. What type of donation is this? Directed. A donor is donating blood that is specifically for their own surgery and not for any other patient. What type of donation is this? Autologous. A donor donates blood every 8 weeks and the unit can be used for any patient who needs it. What type of donation is this? Allogeneic. Apheresis donor collections. A donor wants to donate platelets. How many days must they wait between platelet donations and how many times can they donate in a week? They must wait 2 days between platelet donations and they can donate twice a week. A donor was donating platelets and during the donation venous access was lost and the red blood cells were not returned to the donor. How long must they wait to donate platelets? 8 weeks. An O-negative donor who donated a double red cell, how long must he wait to donate again? 16 weeks. The apheresis process we are performing is erythrocytopheresis. What blood product are we collecting? Red blood cells. A therapeutic apheresis procedure is performed on a patient with the goal of reducing the hemoglobin level of the patient. What condition would this be prescribed for? Hemochromatosis. We collected platelets via plateletpheresis. Each unit of platelets must contain how many platelets? Greater than 3 times 10 to the 11th platelets. A patient who needs a marrow transplant can receive this transplant from 3 different sources. What are the 3 means of collecting a suitable product? Bone marrow, peripheral stem cells, and umbilical cord blood. Progenitor cell donations. What is most important for a progenitor cell donation? An ABO type compatibility or an HLA match? An HLA match. Transfusion practices. A person with severe shock and blood loss of greater than 25% of blood volume, such as from a severe car accident or blast injuries, would need what blood product? Whole blood. A person who is normal volemic and has a hemoglobin of 7 grams per deciliter, experiencing shortness of breath at rest, would require what blood product? Packed red blood cells. Component preparation. A person donates a unit of whole blood. We centrifuge the whole blood and remove the plasma. What product is left after the plasma is removed? Packed red blood cells. To obtain 1 unit of platelets from a whole blood donation, what do we centrifuge with a hard spin to obtain platelets? Plasma. We did pre-storage leukoreduction on a unit of red blood cells. What is the standard for how many white blood cells may remain in the product? Less than 5 times 10 to the 6th leukocytes. We removed plasma from a whole blood unit and froze it 7 hours after donation. What is this product called? Fresh frozen plasma, or FFP. Component storage and transport. What blood product is stored at 20 to 24 degrees Celsius with gentle agitation? Platelets. What temperature are packed red blood cells stored at? 1 to 6 degrees Celsius. What temperature are packed red blood cells transported at, and what do we use to maintain the temperature? 1 to 10 degrees Celsius, and we use wet ice. What temperature is fresh frozen plasma stored and transported at, and what do we use to maintain the temperature? It must be maintained at less than or equal to minus 18 degrees Celsius, and for transport we use dry ice. Transfusion practices. A person with hepatitis B that has liver damage with visible jaundice and has multiple clotting factor deficiencies would be transfused with what blood product? Fresh frozen plasma. A patient is receiving a blood transfusion from a directed donor who is a family member. What must be done to the red blood cells before they can be transfused to prevent graft versus host disease? It must be irradiated. A patient at high risk of bleeding due to severe thrombocytopenia should be transfused with what blood product? Platelets. A patient with a hemoglobin level of 8 grams per deciliter is not actively bleeding received 2 units of packed red blood cells. What would we expect the post-transfusion hemoglobin level to be? 10 grams per deciliter. Transfusion practices expiration. If a unit of red blood cells is washed using a system that is not closed, how long after it is opened does the unit expire? 24 hours. A unit of platelets expires how many days after collection? 5 days. A unit of FFP or plasma 24 can be stored for what period and at what temperature? 1 year, and it must be stored at less than or equal to minus 18 degrees Celsius. A unit of frozen red blood cells can be stored for what period and at what temperature? 10 years, and it must be less than or equal to minus 65 degrees Celsius. Blood components. What blood product contains fibrinogen, factor VIII, von Willebrand's factor, ristocetin cofactor, factor 13, and fibronectin? Cryoprecipitate. What product is frozen at less than minus 18 degrees Celsius, is stored at room temperature after thawing, and must be transfused within 6 hours of thawing? Cryoprecipitate. What blood product must be tested for bacteremia 24 hours after collection and prior to transfusion? Platelets. What product is frozen at less than minus 18 degrees Celsius? It's stored at 1 to 6 degrees Celsius after thawing and must be transfused within 24 hours of thawing? Fresh frozen plasma. Blood component quality control. The pH of stored platelets decreases during storage. What should the pH of platelets be at the end of the storage period? Greater than or equal to 6.2. Platelets made from a whole blood unit should contain how many platelets? Greater than or equal to 5 times 10 to the 10th. Site-reduced red blood cells must contain what amount of the original red blood cell volume? 85%. Transfusion practices expiration. What preservative solution is used to preserve frozen red blood cells for transfusion that must be washed off prior to transfusion? 40% glycerol. When you irradiate a red blood cell unit with 25 grays, what is the expiration date? The original date, or 28 days, whichever is sooner. What types of red blood cells would we want to store frozen, since we don't freeze units routinely except in the military? Rare types such as Bombay. Donation transfusion practices. Why do we collect plasma from men or women who have not had babies? To prevent trolley. Transfusion practices. A patient with IgA deficiency who has a history of anti-IgA antibodies requires a red blood cell transfusion. What type of product can be given to prevent an anaphylactic reaction? Washed or frozen deglycerolized red blood cells. A patient with a history of febrile non-hemolytic transfusion reactions. What type of products would they require to prevent these? Leukocyte reduced. What product is transfused within 24 hours of collection, is stored at 20 to 24 degrees Celsius without agitation, can transmit CMV, and is for patients with gram-negative sepsis that is not responding to antibiotics? Granulocytes. If a patient has a platelet count of 40,000 per microliter and the doctor wants to raise it to 100,000 per microliter, how many apheresis platelets would the patient need? 1 to 3, since they should give a 20,000 to 60,000 per microliter increase. A female patient of childbearing potential who is type A negative needs a transfusion of platelets. There are only A positive platelets available. What medication should the doctor consider giving if these A-positive platelets are transfused. RHIG could be given in case there are any red blood cells in the platelets. Red blood cells was issued to the ER in a container that maintained the temperature at 2 to 5 degrees Celsius. It was issued at 5 a.m. and returned at 5:45 a.m. and had not been entered. Can the unit be returned to inventory? Yes, transport is okay at 1 to 10 degrees Celsius. A segment must remain attached. Recombinant products. DDAVP can be used to increase levels of what two substances in patients with mild hemophilia A? Von Willebrand's factor and factor VIII. What product has replaced a human version which was contaminated with HIV in the 1980s due to its pooled nature and lack of testing? This recombinant product can be given to people with hemophilia A. Factor VIII. Thank you for listening to this review. Please continue to part 2 and don't forget to share, like, and subscribe to my channel. Thank you.